action now.
Today's the best start.
Listen to your body, listen to your heart. Oh, 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 yeah.
Yeah.
Shake your mind, body and soul together for the edge. Tools and information that helps you grow.
Take action now. Today's the best start.
Your health matters. Hi, my name is Dr. Zachary White, and I'm a resident physician in radiation oncology here at Stanford Healthcare. One of the things that got me exposed to the field of oncology was my personal experience with cancer. My mom was diagnosed with breast cancer when I was 9 years old. She was 39 years old when she was diagnosed, and it was a scary time for myself and my family. She underwent chemotherapy, surgery, as well as radiation therapy, and throughout this, she wanted us to know that God was going to be with her and with us throughout the entire step of the way. And to this day, she now stands as a 24-year breast cancer survivor. And my mission is simple. I want to continue to make sure that I make a difference for patients just like her, that may be, diagnosed with cancer, that have that tough experience of hearing the words that you have cancer. It's a scary moment having to sit and hear those words, but you want to have your faith with you, you want to have family, and you want to have a good medical staff supporting you through each step of the way. And that was what my goal was of becoming a physician specializing in oncology. So I remember those times where I sat in the waiting room as she was getting her radiation therapy. And today I stand on the other side, being able to take care of patients just like her. But I remember that time when she was diagnosed, I wasn't really sure, at 9 years old, I was, not sure how she would come out on the other side, but I knew that that experience alone ignited my decision to want to become a physician. Being able to see how I can give empathetic, compassionate care to patients and their families, and hopefully transition them from being a cancer patient to cancer survivor, is something that I think God placed me on this earth to do. And so as she stands as a 24-year breast cancer survivor, I know that she continues to be proud, but I want to continue to be that advocate for our patients, particularly for our patients that come in the doors that really don't know what the next answer looks like. I want to be able to educate them on what things they should watch out for, the treatment plan, and have them more educated about that experience that they may undergo while undergoing their cancer treatments. And so I thank God that He, saved her life, essentially. I thank God that He healed her body. During that time, it was really scary, and one of the things that kept us together was our faith. My grandfather is a pastor, and we literally had people praying across this country for her healing. And seeing that at 9 years old makes me realize that even as I treat patients here at Stanford, that, it's not my healing hands, but it's the one that I'm serving as a vessel, as a conduit. Is God the one? God is the one that is ultimately the one that is healing the patients that I come into contact with. So that experience with my mom really ignited my desire to want to become a physician. And after that, I, went into, Tuskegee. I went and majored in biology there, and it was on a pre-medical track. I then left Tuskegee University and unfortunately didn't get accepted straight into medical school. I was rejected from my first time applying, and it was kind of confusing at first, but I said to myself, God, I know you have a plan. I know you have a destiny. I'm not going to worry about it. You're all in control. So I ended up going to a master's program in my hometown at University of Alabama at Birmingham, a one-year master's. Completed that, applied again, rejected again. And that point, I had to really come to terms and say, God, I don't know what you're trying to do, but I'm gonna let you use me. And after that year, I worked as a pharmacy technician at CVS. And that experience was so beneficial for me to see, was being able to see people come in left and right trying to afford their medications, making that tough decision of whether to put food on the table or pay for the medications that could save their life. And that was disturbing to me, that people in this country, the United States of America, are having a difficult time being able to take care of themselves and buy the medications and have all those medications necessary that the doctor has prescribed. And so it fueled in me that I wanted to not only, make an impact in the clinic, but also make an impact on the policy level as well. And so that experience allowed me and fueled me to want to go to Washington, D.C. And I was fortunately selected as one of the 15 White House fellows appointed by President Biden to be at the forefront in the federal government to continue to make the changes necessary so that we can make sure that every person in this country gets a fair shot at high quality health care. And so going back to, after I left CVS Pharmacy, I studied hard for the MCAT, which is the admission test to get into medical school, and finally got the words, "You have been accepted to medical school." And I started my journey at the University of South Alabama, served as class president all 4 years, the first African-American class president in the school's history. And match day came, which match day is actually today for a lot of students, medical students, trying to figure out where they end up for their residency. And during this match day, different programs rank who they want. We rank who we want to attend for our residency program, our training program. And I opened up that envelope and it said Stanford. And I was leaving. This Alabama boy that has grown up in Alabama all his life is now leaving his hometown and move all the way across the country to the Bay Area. And fortunately, it has been one of the most incredible experiences to get out and fortunately find that community, even despite being so far away, being a member here at Emmanuel Baptist Church. So that experience just made me realize that God always has a plan. We don't always know what the end is. It looks confusing at the forefront, but once we look back, we know that God is always taking care of us and He has the ultimate plan, and really glad that I'm ended up here today. Oftentimes, one of the toughest moments that I have in my jobs is having patients and gentlemen come in, and they come in with late stages of their cancer because they may have missed their appointment when it comes to screening. They may not have access to the screening tools or the insurance that can allow them to get those screenings and catch the cancers at an earlier point. And so I want to tell you today that today is the day that you start thinking about, when was the last time you got a colonoscopy? When was the last time you got a PSA? When was the last time you had your blood pressure checked? All of these things are important to making sure that you live a healthy life so that you could be here for yourself and those around you that you love. All of these diseases that we're talking about, let's start with a cardiovascular health. Making sure that you know what your blood pressure is important not only for your heart, but also important for your brain, for other organs in your body. And so I want men to know that this is the day that you start thinking about ways that you can advance and get back to that point where you can be, that super healthy guy that God destined you to be. The top two cancers that we see when it comes to men, you see prostate cancer. And we see that the best way to screen for prostate cancer is a blood test called the prostate sensitive antigen, also known as a PSA. When we see those PSA numbers slightly climb up, that gets our attention and makes us want to get more further studies to see what's going on. If we're able to catch the prostate cancer at an earlier point, you have an over 90% chance of cure. This is a very treatable disease. Cure rates are well above 90% for most patients that are diagnosed with prostate cancer. We talk about some of the grim statistics about 1 in 8 men will be diagnosed with prostate cancer in their life, but that isn't the end of the story. We have advanced so much as it comes to the scientific field, as it relates to the treatment of prostate cancer. We have multiple modalities of treating it. A patient can undergo surgery or radiation therapy, and oftentimes be completely done with the treatment after that. Each one has its different side effects, but I, think that most patients end up going through it fine and knowing that the cancer is kind of completely gone, and we continue to check that through screening tests after which. Oftentimes with prostate cancer, the symptoms don't usually come about until it's too late. So I want you to get the PSA check because it is super important that we catch cancer earlier so that we can cure you. The other cancer I want to talk about is colorectal cancer. The screening guidelines have now shifted from 50 to 45 for regular risk, average risk individuals. And so those that have a family history of colorectal cancer have to get screened a little bit earlier than that, maybe about age 40. And the screening for that is a colonoscopy. A colonoscopy is a procedure where a camera looks through the entire colon to see if there are any suspicious polyps or cancer inside of the digestive tract. One of the great opportunities we have with the colonoscopy is that we can oftentimes cure patients that have precancer using the colonoscopy and taking the polyp off, and that can prevent the cancer from forming. So think about, when was the last time you received your last colonoscopy? Oftentimes we get a colonoscopy every 10 years to see how things are going. But if we notice some polyps, we want to check more regularly. So make sure you get that checked. Other thing of note is the symptoms that are associated with colorectal cancer. Oftentimes patients might notice bleeding in their stools, loss of weight, fatigue, any type of history of inflammatory bowel disease, all put you at an increased risk of colorectal cancer. And so I want men to know, yes, we have these potential cancers that have the potential of taking your life. We have different measures and preventative measures in place so that you can prevent getting these cancers in the first place. So how can I prevent myself from getting cancer? Having a healthy diet, rich in fruits and vegetables, limiting or reducing or abstaining from alcohol altogether. Abstaining from cigarette smoking is another way to prevent. Weight loss, active exercise, having active exercise with about 30 minutes per day throughout the week will really do a great job of, reducing your risk of cancer and also giving you a great cardiovascular health as well, and just an overall health in general. And so I just want to leave you here today that your health matters. Today is a day that I want you to start thinking about ways that you can continue to improve your health so that you can continue to be the best that God has for you. When you actually, take that initiative and have the support of those around you, you can continue to live a awesome life when you take mind of your care. It's going to take you. You are going to be the one that's going to make that difference in your life. And I want to challenge you today that today is the day. You can do this. You can look back and say, let me take an extra 30 minutes today and take a stroll around the park. You should make an appointment with your primary care physician. That's the number one step, so that you can get those checks, such as your blood pressure, cholesterol, your PSA, making sure you're up to date with your screenings. Your primary care physician is going to be your go-to point of making sure that you're getting on the right trajectory. You can do this, and today is the day.
Take action now. Today's the best start. Listen to your body, listen to your heart. Oh, yeah. Shift your mind, body, and soul together for the edge. Tools and information that helps you grow.
Take action now. Today's the best start.